When we suspect that our patient might be suffering from a stroke, it's very important to check a blood sugar right away. And the reason is that most likely the patient will have signs and symptoms of altered mental status, meaning confusion, answering the wrong questions, or maybe even have facial droop or speech impairment. And blood sugar, when it's low, can mimic the same symptoms, and then we can kind of rule out that the reason for the patient's altered mental status is the blood sugar rather than a stroke. So this is the number one thing we need to be doing, is checking the blood sugar. If the blood sugar is normal and the patient continues having the symptoms, we need to rush them to the hospital right away and get a stat CT of the head without contrast. And that's just a plain scan of the brain to check for any bleeding in the cranial cavity, because the treatment for a hemorrhagic, a bleeding stroke, and an ischemic stroke, the one that is caused by a blood clot, is very different. We also want to check a CBC and a CMP to check their blood count, kidney and liver function, because we need to anticipate that we're going to give the patient some medications to help improve these symptoms. We also want to check their coagulation studies with PT and INR, because if they're bleeding, we need to know what those bleeding times are. And if we're going to treat them for a lack of blood flow for an ischemic stroke, then we also need to know the baseline of where we are. And then sometimes always when the CT head without contrast is negative, so not showing any area of bleeding, then we perform a CT head angiogram, which is the one with the contrast that really just helps us light up the blood vessels a little bit more, so that we can now see where is that lack of blood flow from the ischemic stroke. Additional tests that you might see, not necessarily in the emergency setting, but as the patient gets hospitalized and we're trying to figure out the root cause of the stroke. So you might see an EKG because atrial fibrillation is a risk factor, an echocardiogram because valve disorders of the heart can also be involved, a carotid ultrasound to check for arteriosclerosis because ischemic stroke is also related to arteriosclerosis. Certainly we want to check a lipid panel for the exact same reason. And then the patient down the line, a few days down the line, usually gets an MRI or MRA. The difference is again without and with contrast. And then MRI is just a more or a better diagnostic tool that lets us determine the extent of any kind of damage from an ischemic stroke, the pressure on the brain tissue that has been evoked from either the bleeding or the lack of blood flow. And then we can also check a drug screen if we're suspecting a drug-related stroke, because cocaine is a drug that sometimes can be related to having strokes, especially subarachnoid hemorrhages. So please also check out the other videos that I have in the stroke series, where I go a little bit deeper into the different types of strokes and signs and symptoms you might be seeing. Thanks for watching.